Good afternoon. My name is Allison Ranslow, and I'm here from Penn State University's Humanitarian Engineering and Social Entrepreneurship program. Today I'll discuss a research project worked on by myself, Dan Crompton, Khanjan Mehta, Peter Butler, and Jim Adair, entitled Empowering Community Health Workers with Inkjet Printed Diagnostic Test Strips. Let's begin. To start off, I first wanted to introduce the program at Penn State through which this research was conducted. Penn State has a Humanitarian Engineering and Social Entrepreneurship program, or HESE for short. The program engages students in the rigorous research, design, field testing, and launch of technology-based social enterprises. We work primarily on global development challenges in multiple African countries. The focus is on sustainable and scalable solutions that are technologically appropriate, culturally acceptable, environmentally benign, and economically sustainable. My team is part of the Ukweli Test Strip Venture. The aim of this venture is to investigate the use of inkjet printed test strips in the developing country context. One of HESE's main focuses is access to healthcare. Lack of access to healthcare is one of the biggest challenges facing the world today. This is primarily an issue in developing countries where incomes are low, people are typically uneducated, and there simply aren't enough well-trained doctors to treat everyone. For instance, Kenya relies on just one doctor per 10,000 citizens, a stark disparity to the 26 physicians per 10,000 in the U.S. Another issue is the inability to diagnose, prevent, and treat diseases, which leads to an overall unhealthy population. There are three main classes of factors that lead to poor health. For human factors, income is a major barrier. The average income in developing countries is less than $2 per day, leaving inadequate funds to pay for health care. Due to low income and thus low levels of education, a majority of people are unaware of symptoms and diseases and have limited access to well-trained professionals. On a systemic level, the government does not provide ample funding to fund healthcare initiatives. Without funding, hospitals and medical centers do not have the staffing, training, and equipment necessary to keep their communities healthy. This in turn leads to issues with technology. Since there is minimal funding and minimal education, there's an inability to pay for expensive and accurate equipment, which leads to broken devices or devices that are too complex for minimally trained workers. It is an endless cycle that is in dire need of innovation to meet the specific needs of low-income, low-education communities in the developing countries. A type of program that has proven to be effective in developing countries is known as community health worker programs run by community health workers, or CHWs. Well, you might ask, what is a CHW? CHWs are dedicated members of their communities who receive basic healthcare training in a variety of tasks. CHWs serve as a link between communities and healthcare professionals as they are responsible for monitoring the health of a certain number of households in their community. CHWs set up health kiosks where they conduct a basic physical exam on patients for obvious symptoms using very simple medical devices. Although CHW programs are great, there are some barriers to realizing their full potential. When it comes to medical devices, they can only be as good as the device they are using. Screening tools used today in the developing world are typically nonspecific, testing for many conditions, and often include over 10 biomarkers, making them difficult to interpret without the help of a medical professional. Because of this, patients must travel long distances to clinics with medical professionals, making healthcare inaccessible and unaffordable to people in rural areas. Most of the biomedical devices available in developing countries like Kenya are not designed for the context. They cannot withstand the harsh climate of the heat, dryness, and sun, along with rough transportation systems, or are beyond the workers' levels of training or technicians' ability to repair them. Lastly, specific and sensitive tests that reproduce accurate results are expensive both to buy and to maintain, thus are out of the price range of both CHWs and the members of the community. To help guide the design of ideal diagnostic medical devices for developing communities, the World Health Organization developed a set of criteria known as Assured. However, unfortunately, most devices in the developing world do not even meet half of these criteria. One way of mitigating the issues of the current diagnostic tests and ensuring that all assured criteria is met is the incorporation of inkjet printed diagnostic test strips into already established CHW programs. The technology of an inkjet printer can be harnessed to deposit biochemical reagents onto paper test strips simply by replacing the ink in the ink cartridges with those reagents. The deposited reagents would then react with specific biomarkers in bodily fluids such as blood or urine and result in a color change to indicate a positive test. The combined cost of the printer and reagent in the cartridges is significantly less than most other modern diagnostic devices. Additionally, the test strip printing process is much simpler than current manufacturing alternatives, allowing even previously untrained workers to produce them within the existing infrastructure of many developing countries. Adopting the in-country production of inkjet printed diagnostic test strips could empower local CHWs while enhancing their services. In particular, it would allow them to provide better and more valuable pre-primary care in their communities by lowering prices and offering improved diagnostic services. This proposed idea fully satisfied the assured characteristics. Firstly, the strips are affordable. Strips can be manufactured for 3 cents each, sold to the CHWs for 10, and then are available to the end user for only 20 cents each, whereas a more complex diagnostic test involving electronics might be 10 times as expensive. The tests are sensitive and specific. Of course, this takes a perfect balance between chemical reagents on the strip. However, the use of certain chemicals have proven to be sensitive and specific in their results. Since the strips are fairly self-explanatory with a drastic color change indicating a positive test, there is not much discrepancy left to the user, and this makes testing extremely simple for CHWs to use and interpret. Inkjet manufactured test strips are rapid in that they produce results in a matter of minutes and do not require being sent to an external lab for analysis. They are also robust in that when transported and stored in an airtight container will not break or malfunction as a delicate electronic instrument would. These strips, of course, only rely on eyesight to detect a visible color change and do not require any outside equipment for analysis of results. Last but not least, when integrated into our current CHW programs, these strips are extremely deliverable to end users. We plan to leverage the current CHW supply chains and distribution channels to bring these strips to users in the community. The manufacturing of these strips will be done outside of the CHW program. Ideally, lab space would be rented at a low cost from the Children and Youth Empowerment Center to serve as a manufacturing location. From there, the strips will be printed, cut, and packaged for about 3 to 5 cents per each. The strips are developed by filling empty ink cartridges with chemical reagents, placing them back into the printer, then printing the paper sheets as normal. This work is simple enough that a minimally trained worker can complete it without much hassle. The strips are printed with various indicators that change color under certain conditions. These strips shown here are representative of strips that would be used to detect UTIs in urine. 3 characteristics of a UTI are an elevated pH and the presence of nitrites and leukocytes in a certain concentration. Indicators were chosen here such that under those conditions, a reaction would result in a color change. The before and after colors of the strip are shown here. The incorporation of this technology into CHW programs would benefit a number of people. First, it would be of great benefit to the CHWs using the strips. It would enable them to make money by administering the test and improve their livelihoods. This not only helps them, but also improves the pre-primary healthcare of the community. If CHWs are able to offer sensitive, specific, and affordable diagnostic testing to the community members, the community will be more willing to get the test done since they don't have to pay expensive fees and travel longer distance away from home, which in turn improves overall health. Lastly, these strips have the potential to be used by hospitals and clinics as well as CHW programs. This would further expand the benefit of the affordability and accessibility of the strips. In order for the strips to be assured and successful, there are many considerations that must be addressed. Strips must be easy for semi-trained workers to operate and thus must produce an obvious color change. CHW training will be necessary to become familiar with the testing process and using the tests on patients. Since the tests are ultimately equipment-free, the training will be fairly simple and will work around correct identification of results. The accuracy of each test is dependent on the sensitivity and specificity of the reagent's reaction to pathogens. Minimizing false positives and false negatives is a must. This can be done by repeatedly testing the results of each test and ensuring that it has reproducible accuracy. As for longevity of the strips, the usable lifespan must be considered. One major consideration is humidity. To avoid this, small silica desiccant packs will be included in each group of test strips. The current Uqueli team has been working hard to make progress on this original proposition, since our team ran out of time to bring the product to life. They focused solely on UTIs for these tests. They were actually able to print neutral red, a UTI marker, and have it positively detect bacteria, a characteristic of UTI. A cartridge cleaning protocol and troubleshooting guide was also developed. This is crucial as those working the printers to develop the strips will only have a basic working knowledge of that printer. This project is still a work in progress. Work is being done to experimentally determine the exact color changes of the reagents under different concentrations and validating the testing strips through bench testing. Throughout this process, investigation will be continued for other uses of this platform technology. The team currently has stage 1 and 2 funding from VentureWell, totaling $25,000. Inkjet printed test strips have the potential to integrate into existing CHW programs and conform with the assured framework. Printing of the strips makes them much more affordable than current alternatives and also allows them to be sensitive and specific using a variety of reagents. Tests are user-friendly as they only rely on a simple color change to determine results. Manufacturing the strips via inkjet printing is also quick and requires very little capital. Finally, the simplicity of the printing technology and the minimalism of the strips themselves makes them more deliverable and accessible to the end users. If all these challenges can be addressed, inkjet printing test strips have the potential to make testing cheaper and easier for CHWs, and in turn benefit communities throughout the developing world. Thank you, and I'd now like to open it up for questions.